Imagine sending your child to school only to learn they've been exposed to a highly contagious disease that could have been prevented. It's a parent's worst nightmare, and it's happening right now in South Carolina. Let's dive into this alarming situation and what it means for public health. Written by Sarah Manusco, a dedicated health and lifestyle journalist at CBS News. With a background at USA Today, where she helped pioneer their wellness section, Sarah now brings her expertise to breaking health stories through CBS News Health Watch. For more on her, check out her full profile. October 13th, 2025, 9:56 a.m. EDT. CBS News. Local health authorities in South Carolina have announced that a staggering 153 students who haven't received the measles vaccine are now in quarantine following exposure to the virus at 2 local schools. This measure is crucial to stop the spread, especially since these kids lack the immunity needed to fight off the infection. During a press update on Thursday, available to watch here, the officials explained that these students, identified as close contacts without protection, must stay out of school until the risk window for spreading the disease passes. It's a tough call, but one that's essential for keeping everyone safe in the classroom. The affected schools, Global Academy and Fair Forest Elementary in Spartanburg County, are teaming up closely with the South Carolina Department of Public Health. Together, they're rolling out all the recommended safety protocols to safeguard students, teachers, and staff. If you're a parent wondering how this works in practice, think of it as a coordinated effort. Extra cleaning, contact tracing, and clear communication to everyone involved. In that same Thursday briefing, the team verified South Carolina's 11th measles case of the year, with the 8th one popping up since late September. And this is the part most people miss. These aren't isolated incidents. They point to ongoing, undetected spread of the virus in the upstate region, underscoring just how important it is for everyone to get vaccinated against measles. A statement from the South Carolina Department of Public Health put it bluntly. This latest case highlights active community transmission that's flying under the radar, making vaccinations more critical than ever to shield the public. The very next day, on Friday, the department issued another alert, emphasizing that measles spreads like wildfire. It's one of the most infectious diseases out there. The virus can hang in the air for as long as 2 hours after someone who's sick has left the room, which is why crowded places like schools are such hotspots. For beginners, this means even if you don't see the infected person, you could still breathe in the virus particles. The best defense? The measles vaccine, usually bundled into the MMR shot that also covers mumps and rubella. It's a simple, effective way to build immunity and protect not just yourself, but your family and community too. But here's where it gets controversial. Despite overwhelming evidence of its safety, some folks still hesitate due to misinformation. More on that later. Now, let's talk about why measles is no joke. This virus can trigger serious complications, like fierce infections in the lungs, pneumonia, or even the brain, encephalitis, which might result in long-term problems such as learning difficulties, hearing loss, or in the worst cases, death. Health experts are quick to point out, though, that the vaccine is incredibly safe and works wonders in preventing these outcomes. For context, it's been rigorously tested and monitored for decades, saving countless lives worldwide. This South Carolina cluster isn't happening in a bubble. It's part of a worrying nationwide uptick in measles cases. Take Minnesota, for instance. Just this week, officials there reported 2 fresh cases, pushing the year's total to 20. According to the Minnesota Department of Health, these involved unvaccinated kids who probably picked up the virus from an unvaccinated grown-up. Out of all 20 cases, 18 are in children, shining a light on how vulnerable our youngest are when protection rates slip. Zooming out further, the U.S. saw its highest number of measles infections in over 3 decades earlier this year, per Centers for Disease Control and Prevention, CDC figures. Many of those were tied to a major outbreak in West Texas, which tragically claimed the lives of 2 unvaccinated children. A heartbreaking reminder of the stakes. If you're new to this, Outbreaks like these often start with international travel bringing the virus in, then spread locally among those without immunity. Looking at the numbers, CDC stats reveal that about 93% of U.S. kindergarteners got their measles vaccine in the 2021-2022 school year, dipping slightly to 92.7% for 2023-2024. That's a decline from the 95.2% mark in 2019-2020, and here's why that matters. 95% is the magic number for herd immunity. In simple terms, herd immunity is like a protective shield for the whole group. When enough people are vaccinated, the disease can't easily jump from one person to another, safeguarding even those who can't get the shot, like infants or people with certain medical conditions. The CDC explains it well. With over 95% vaccination in a community, the odds of an outbreak plummet because the virus runs out of susceptible hosts. But in South Carolina's upstate area, immunity hovers around just 90%, per the latest local update, leaving a dangerous gap where the virus can gain a foothold. Edited by Lucia I. Suarez-Sang. Related topics, South Carolina, measles. So, what do you think? Is vaccine hesitancy the biggest roadblock to beating back diseases like measles? Or are there other factors at play, like access to healthcare? And here's a counterpoint to ponder. While vaccines are proven safe, could improving education on rare side effects build more trust without fueling unfounded fears? Share your thoughts in the comments. I'd love to hear if you faced similar concerns in your community and whether this changes your view on school vaccination policies.